Good morning, Chairs Guthrie and McMorris Rogers, Ranking Members Shuhu and Paloon, and members of the committee. My name is Jeanette Ashlock, and telehealth has become an essential part of how I stay as healthy as possible. Thank you for having this important conversation. I was diagnosed with multiple sclerosis, or MS, in 2001. At the age of 30, I experienced my first MS symptoms right after my honeymoon when I returned to my job at a folding carton manufacturing company. My muscles and body started locking up. I was losing my ability to control my movement and losing function. Work started to feel dangerous to me since my office was located in the warehouse where the forklifts traveled daily. So I went to urgent care. After that, I saw a neurosurgeon and then a neurologist who delivered my MS diagnosis. My first 8 years living with MS was extremely difficult. I dealt with significant pain, tremors, lost vision, and was hospitalized every few months. Within just 3 years of my diagnosis, my symptoms were severe enough to require me to use a cane and then a wheelchair. My neurologist worked with me to make sure I kept moving my body to maintain my function. He kept saying, if you don't use it, you're going to lose it. After that first 8 years in trying and switching medications several times, my MS stabilized and symptoms improved. I have not had a relapse since then and am now able to walk on my own. I do continue to have symptoms like severe fatigue. I had to stop working because of my symptoms, and I've been on Medicare since 2 years after my diagnosis. I'm among the many people living with MS who can manage their disease and maintain their quality of life because of the care I receive from a network of healthcare providers. Since Medicare removed many of the restrictions around telehealth, my ability to use telehealth for some of my care needs has become absolutely essential to me. I have used it for appointments with my primary care provider and some of my specialists, including my OBGYN. I have been able to talk to my providers for follow-up visits. For example, after having lab work done and to talk through new health issues as they come up. Many times I've called and been told that I can't get an in-person appointment in months. It would take months, but I can get a quick telehealth visit right away. I've been able to stay on schedule with my visits and bring up issues right away so I can prevent them from becoming more serious down the road. Like many people with MS, I deal with some cognitive issues, including some memory problems, and it gets worse when I experience stress. When I am doing a telehealth visit from my home, I'm able to sit at my own kitchen table in front of my computer and have my pen and paper with my questions written nearby. And I'm so much more prepared. I am able to describe every symptom and remember every single question I meant to ask and take really good notes. Instead of having to memorize what my providers are sharing with me, I am also better able to manage my fatigue when I can go to visits from home rather than driving to and from in-person appointments. Telehealth has also helped ease the stress of going to the doctor, and my telehealth visits do not feel rushed. So often, as soon as you touch that doorknob in the doctor's office, everything you had in your mind to talk about just melts away because it can be stressful. And then on the way out of the door from the visit, everything you discuss melts away. With my telehealth visits from my house, I am much more relaxed and able to have much better appointments. It has been so much better for my health all around. Finally, one of the biggest reasons I'm so grateful for telehealth is because during the pandemic, I was able to access a mental health provider via a telehealth for the first time. Like a lot of people with MS, I sometimes face mental health symptoms. I was able to find a therapist who was a little further away from my house, but able to see me right away via a telehealth, without the long wait that you usually face when seeking a therapy appointment. I have been able to meet with her regularly through our telehealth appointments, and it has made such a difference in my life. I'm not the only person in the MS community who benefits from telehealth, and I want to represent some of their needs today as well. Unfortunately, many people living with MS, especially those in rural areas, reside in areas with limited or no neurologists. These are often referred to as neurology deserts. For people with MS who live in those neurology deserts, or for those with mobility issues or those with no accessible transportation, telemedicine can offer meaningful access to care for those who may struggle to get it otherwise. It is so important that patients continue to have a choice of whether to use telehealth when it's appropriate. I urge the committee to advance legislative solutions to make sure that our telehealth access does not disappear. Thank you.
Can you talk about how telehealth has impacted your MS patients through the pandemic? You talked about that, but were there times that you say, I really need to come into the office, and was your opinion listened to, or did you ever have that situation? Or do MS patients or any patient, you know your body's better than everybody else, and so you know what, I know I'm doing this through telehealth, but I really think I need to see you. Was that receptive if you had to do that?
Yes. There was a time when I said I would like to come in, but once again, it took me a while to get that in-person appointment. When I was having some women issues, the OBGYN, I was like, I think I want to come in and get checked out or have that one-on-one with you in person.
Ashlock, I was going to start with you and appreciate you being here and sharing your story and hearing your testimony and Dr. Schwam's testimony. It strikes me that there's many different factors that could make telehealth versus in-person care the right choice for each unique patient in their unique situation. As a patient or as a provider, what are some factors that you consider when deciding whether you want to do a virtual or in-person visit, and how might those factors be unique to each individual?
To me, because of my multiple sclerosis, if I am having an exacerbation, we know that it takes 3 months to get a neurologist appointment. When I'm having an exacerbation, I have a 24-hour window before it becomes severe. So that's a telehealth to me, and because he can order a nurse to come in to do my infusion for steroids. My in-person to me is when I need to do follow-ups with my neurologist. He has to check on my vision, my walking gait and things like that. I need to go in person because he needs to physically do some tests.
Ms. Ashlock, I'm a Virginian as well. Can you please explain where your providers are located when you use telehealth services and why it's important that we continue to have these services in the Commonwealth of Virginia?
My mental therapist, she was like maybe 45 minutes away from me, and this is right during COVID, and it was very hard to get an in-person appointment, so I chose telehealth. And I liked it. It's important that we do keep it. What about those people that are homebound, that can't get out? And another thing that I like about telehealth is that you can have someone join you. So my son that's in Texas, if I need him to join me, he can join me and listen in on my telehealth, in which that's important to me with multiple sclerosis so that he understands where his mother is with their MS.
Yes, ma'am.
Ms. Ashlock, how would extending the telehealth flexibilities impact the quality and the continuity of care for patients like yourself?
Thank you for the question. For patients like myself, it's essential to have that tool in our health care, to have telehealth, because some of us, you see me with MS, but it's like a snowflake disease. All of us are different. Some have mobility issues. Some can't get, transportation, living in a rural area. So it's important, you have to drive 3 hours to go to a neurologist. That's 3 hours one way and 3 hours back. You have a caregiver that has to take off. So with telehealth, they can limit those trips. They can be able to see their doctor. I can still get the care that I need without the stress and have to go into a doctor.
I want to start with Ms. Ashlock. I want to ask you a question. What would happen in your healthcare situation if Medicare stopped covering telehealth and these flexibilities expired? What kind of impact would that have?
Thank you for the question. The impact that it would have is I would not get the immediate care that I'm getting now. I will have to wait for in-person appointments, and with specialists, that's like 3 months in advance. You have to wait for me to see my neurologist, where we could be having a symptom going on where I need to see the neurologist like yesterday.
Ms. Ashlock, thank you for sharing your personal experiences with telehealth services during the COVID-19 public health emergency. Why do you believe that telehealth should continue now that the public health emergency has expired? And I know you've answered that a lot, but what is the recommendation if you were to have one major change on the way we use telehealth and our policy towards telehealth? What is that most important change that you would recommend to Congress?
Thank you for the question. The most important change I will have is let the decision be between the doctor and the patient.
In terms of?
In terms of the care, should it be telehealth or should it be in person? Let them have that discussion if they should go in or they should do telehealth.
Now, Ms. Ashlock, I know you've talked a lot already today about your condition, but just briefly, is there anything else you'd want to add on what would change in your life if Congress fails to extend telehealth policies?
Thank you for the question. What would change in my life would be the comfort, and not have the stress to go to my doctor's appointments. Finding parking space is just the ease of being able to get an appointment and also being able to have my family to join an appointment with me. That would all go away.
The first question will go to Ms. Ashlock. I'm encouraged to hear that telehealth was so valuable to you and allowed you to get the mental health care you needed. Broadening telehealth access for mental health and behavioral health services is something I worked on for many years through the enactment of the provisions, My Ease Behavioral Health Services Act during the pandemic. From your experience, how has telehealth access made reaching out and receiving mental health care easier for patients?
Thank you for the question. Sorry, I didn't hear my name in the
That's
beginning.
okay. That's okay.
Reaching out for mental health, it was, at first it was hard, because like I said, when I reached out, it was in the middle of COVID, and I think a lot of people were reaching out for mental health at that time. So at first it was hard to get an appointment, even to get to, talk to someone at an office, because they were not in the office. But once I did find someone, that, like I said, it wasn't close to me, that experience of just feeling like I was in my living room and be able to have that mental therapy was the plus for me, especially dealing with depression during that time.